So I think that's everyone in for now. I'll keep an eye out on the meeting room just in case we get anyone else waiting. So hello. So my name is Luke. For people who don't know, I'm the head of support and communications at the TSC. For those who don't know too much, so I deal with the events side, and also obviously everything to do with support, our support line, and any information we give out and stuff like that as well. Lots of people are old hands to this now, the virtual events, especially at the TSA. We've done so many of them over the last year and a bit. But this one in particular, I'm so pleased that we've got it on, because we get a lot of inquiries and calls and emails on the TSA support line about people who are finding not only times in COVID, but times pre-COVID, and I'm sure after COVID as well, things difficult. So it's with absolute pleasure. I'm absolutely delighted to have with us today Dr. Jennifer Black, clinical psychologist at Bristol Royal Hospital for Children. And I'm going to just go through some very quick housekeeping bits, and then I'll pass over to Dr. Black so everyone can hear from her. So we're recording tonight's session. If you prefer not to be on the recording, just put yourself on mute and take yourself off video. But don't let that put you off asking any questions and things at the end. And if you do have any questions during the session, feel free to put them in the chat also. And roughly what we find in these sessions, what works well is we get an expert such as Dr. Black to give us a bit of an overview about the topic, and then we'll have a bit of time at the end for questions as well. So so without further ado, I will hand over to Dr. Jennifer Black now. So thank you, Jennifer.
Thanks, Luke. Thanks for the introduction. I'm just going to share my screen because I've got some slides. If you can just let me know if you can you see that?
Yeah, we can see that. That looks great.
Okay. Right. Okay, yeah, so thanks for the introduction, Luke. So as Luke mentioned, my name's Jennifer Black. I'm a clinical psychologist working at the Bristol Royal Hospital for Children. And today I'm going to talk probably for about 35-ish minutes about acceptance and commitment therapy, which is a values-based approach to improving mental health. And I'll be talking this evening about applying this approach to children and young people with TSC. We know that living with a long-term physical health condition can be really difficult, and it's important that we think about how we can support people to live well alongside ongoing health problems, and that's part of where ACT is a really, really good approach. What I'll talk about first is making that link between kind of physical health and psychological health. And then I'll go on to think about acceptance and commitment therapy and describe what it's about and how it works. And then I'll talk a bit more about a study that we are running at the hospital in Bristol, looking at the use of ACT with children and young people with TSC. And then there'll be some space for reflections and questions and answers at the end as well. Okay, so I'll start off by talking about stress. Okay, now stress is a normal, natural emotion that all humans have and that we experience it day to day. And there can be multiple factors that influence how stressed we might feel. And there's a few on the slide there, but it could include health worries, conflict with family or friends, experiencing a bereavement, work stress, job loss, lack of sleep, physical illness. And these factors tend to sort of mount up. And stress can be really positive. Can everyone hear me?
Yes.
It just came up saying that I was muted.
Oh. Yeah, we can hear you.
Yeah, okay. So stress can be really, really positive, okay? It can help improve our performance, it can help to motivate us and make us more alert. But when we are under an excessive amount of stress, our performance can deteriorate. And if stress is chronic or continuous, then it can lead to difficulties with anxiety, or it can really deteriorate our mood. Okay, so the stress bucket here shows how different triggers to stress can fill up our internal bucket. And if we don't manage that stress with helpful coping strategies, then our bucket can overspill and we can start to feel overwhelmed. So by engaging in helpful coping strategies, we can relieve some of that pressure and improve our ability and our capacity to deal with stress. Okay, so some of those helpful coping strategies might be taking regular exercise, adapting a healthy lifestyle, improving your self-care and doing things for yourself or things that you enjoy. It might be about socializing, making sure you get enough sleep, or taking up techniques for worry management and problem solving. Okay, there are some less helpful strategies that might include drinking alcohol, taking drugs, or smoking, which might feel relieving in the short term, but tend to make us feel worse in the long run. Okay, now it's actually really difficult to manage stress when we feel stuck in negative or unhelpful thinking patterns. Okay, and if we feel like we're not living life in the ways that we would like to over long periods of time, that can really affect how we feel and what we do. And that's really where ACT comes in. Okay. So ACT is a branch of cognitive behavior therapy. Okay. It stands for acceptance and commitment therapy. Now, cognitive behavior therapy, or CBT, looks at the link between our thoughts, our feelings, and our behavior. Okay. And whereas traditional CBT would help you to identify some of those negative or unhelpful thoughts and look at cycles and patterns and try to change those thoughts, ACT holds central the assumption that pain and discomfort are a fact of life. Okay, it's part of being a human being. So rather than focusing on changing those thoughts and feelings directly, it seeks to change the person's relationship to them. Okay, and often actually what we find is, even though we're not targeting the thoughts and feelings directly and trying to change those, we do notice an improvement in mood, lowered levels of anxiety. So although it doesn't target them directly, we do notice a difference. Okay, in ACT, there's no such thing as wrong thinking. It's just whether or not that thinking works for you. And by that, it's about whether or not that particular way of thinking changes what you do, whether it helps you to work towards behaviours that are in line with your wider life goals. Okay, so is that thinking getting in the way of what you want to be able to do? Okay, some of the strategies that ACT uses in its approach are mindfulness, acceptance, and cognitive diffusion. And so what I'm going to do is I'm going to go through some of those now. This is an analogy that's often used in ACT, okay? And this comes from mindfulness. So it's been said that you can't stop the waves, but you can learn to surf. And in other words, you can't stop the waves and the ups and downs that life will throw at you and that will come up throughout your lifetime. But you can learn to surf the ups and downs. Or life isn't about waiting for the storm to pass, it's about learning to dance in the rain. ACT is about identifying what matters to you, your core values and what's important. It's about helping you to create a rich, full and meaningful life while accepting the pain that life inevitably brings. By using skills to learn how to manage painful thoughts and feelings, you can accept those feelings as being there, but not let them get in the way of you taking action towards what's important for you. Okay, so I want you to follow an example with me. I want to bring awareness to how we react to pain or stress that comes up in our lives. Okay, this is my colleague, Sam Malins. He works on another project that I'm linked to, and he's kindly let me share his pictures here. So awareness is really, really important, because we can make our problems worse when we're not aware of how we're responding to them. Okay, especially at times of high stress, natural, normal human reactions can actually make the stress worse when we're not aware of the role that they're playing. To illustrate this, I want you to imagine this box is a pain or a stress in your life at the moment that you can't get rid of, okay? It might be a physical pain, a work stress, or a home stress, but it's one that you can't get rid of, and it's part of life, something you have to deal with and cope with. One normal reaction to pain is to try to avoid it. Okay, you might think, I'm sick of feeling like this. I just don't want to think about it anymore. And it's normal to want to push something away and to avoid it when it's painful or stressful to think about. However, in doing so, it can sometimes add to the burden of the stress. Another natural reaction is rumination. Okay, this is where we're thinking over and over about a stress, trying to problem solve it. But it's actually a problem that no amount of thinking will solve. Okay, so no matter how much thinking we do, this is a problem that can't be resolved through thinking about it. But rumination tends to drag our mood down and adds to the stress of the weight that we need to carry. So we can end up getting quite self-critical and beating ourselves up about the way that we're dealing with stress. We might think, oh God, I'm so rubbish at dealing with stress. I can't handle it. So-and-so handles stress so much better. Why can't I deal with it like them? And so this can add another layer of burden to that original pain that I talked about. And in the end, we can wind up feeling overwhelmed by the whole situation. And you can see here how the initial stress and the way we react to it can massively add to the burden that we have to bear. What's helpful is that all of these reactions to stress are caused by battling or struggling with the original stress or pain, okay? So if we're able to stop, take a step back and let go of the struggle, we're less likely to feel overwhelmed. We don't need to give ourselves a hard time because we're doing our very best and we can't do everything. We don't need to try to think through a problem to try and solve a problem that can't be solved. And we don't need to try and avoid a problem that's unavoidable. Then we're just left with the stress. We can't get rid of this, but it's much easier to deal with the stress and the pain on its own without all of those reactions on top. So in a nutshell, as I've just gone through the example, ACT is about acknowledging and accepting that all thoughts and feelings are normal. Okay, it's about changing the way we relate to the pain. It's about thinking about what's important for you and choosing goals that take you in a direction that's in line with your values and taking action to work towards those goals. Okay, so how do we do this? Let's start with acceptance. So acceptance is about having a willingness to open up and make room for painful feelings, sensations, urges, and thoughts. It's about simply noticing them with curiosity, dropping the struggle with them, and we can use mindfulness to be present in the moment without judgment on the thoughts and feelings that we're having. So I'm going to do a short mindfulness exercise now. So you don't have to join in, but if you'd like to, I'll go through the guided meditation with you now. So what I want you to do is to find a comfortable position and either close your eyes or focus on a spot in front of you and bring your awareness to your breathing. Scan your body from your head to toe, noticing the sensations you can feel. Zoom in to the part of the body where you're feeling something most intensely. This could be a physical sensation in your body, like pain, or an emotion, or a thought in your mind. When you've settled on something, observe it carefully, as if you're a curious scientist that hasn't encountered anything like it before. Notice where it is in your body and where you feel it most intensely. Notice where it starts and where it stops. If you drew an outline around it, what shape would it have? Is it on the surface of the body or inside, or both? And as you are noticing that feeling or sensation, gently breathe into it. Imagine your breath flowing into and around the feeling. Take a deep breath in through your nose and out through your mouth. And as you're breathing into it, see if you can just open up around it a little and give it some space. Make space for the feeling, expanding around it. Slowly breathing into it and opening up around it. And see if you can just allow this feeling to be there. See if you can let it sit there for a moment. You don't have to like it or want it. Just allow it and let it be. Allow it to be just as it is in this moment. You might feel a strong urge to fight with it or to push it away. If so, just acknowledge the urge is there and continue observing the sensation. If it changes by itself, then that's okay. If it stays the same, that's okay too. Your aim is not to get rid of it, but simply to allow it to be there. Sometimes your thoughts might hook you and you might become sidetracked. This is completely normal. As you notice this, just bring your mind back to the visualization exercise. You may notice different feelings that come up. They may be pleasant or unpleasant. Feelings are really important and they tell you some valuable information. It tells you you're a normal human being with a heart. It tells you that you care and that there are things in life that matter to you. Sometimes difficult feelings might show us that there's a gap between what we want and what we've got. And sometimes the bigger the gap, the bigger the feeling. Now take one of your hands and place it either on a part of your body you've identified in pain, or place one hand in the other And I want you to imagine that this is a healing hand. The hand of a loving family member or friend. And feel the warmth flowing from your hand into your body. Not to get rid of the feeling, but to make room for it. To soften up and loosen around it. And hold it gently, as if it is a tiny baby or a frightened puppy. And then let your hand rest and fall. Once again, breathing into the feeling and expanding around it. So I want you to imagine that your life is like a stage show. And on the stage are all of your thoughts and all of your feelings and everything you can see, hear, touch, taste, and smell. And for the last few minutes, what we've been doing in this exercise is to dim the lights on the stage and shine a spotlight on this one feeling. And now it's time to bring up the rest of the lights. So bring up the lights on your body, and I want you to notice your arms and your legs, your head and your neck. And you can move them around a little and take a stretch. And just notice yourself stretching. And notice how your body feels. And you can bring up the lights on the room around you. And when you're ready, open your eyes and notice what you can see and what you can hear. And welcome back. So that was an example of a mindfulness exercise that we might use with ACT. Okay. How did people find it? If people feel happy to speak up or put in the chat, was it quite difficult to stay focused?
I think the main thing that I noticed is how much more relaxed I feel now compared to when I started. But it was very interesting. Yeah, if you can do this every week, that would be great.
I'll come back.
I think it can be quite difficult when you're kind of in the mid of a crisis to completely concentrate and remove yourself from the problem itself. You find that your mind's kind of diverting back to the stress, whatever that might be.
Yes, that's so true. It can be really, really difficult. And it's one of those techniques that often we neglect until we might feel like we're in a crisis. And it can be, mindfulness is hard, really hard.
Yeah.
It's one of those skills to practice. And I completely agree with you. It can be really difficult to pick up when you're feeling overwhelmed and really stressed.
It takes a lot of discipline, isn't it, to kind of really train your mind to keep it focused on that.
Absolutely. And there is, I guess, some people find guided meditations more helpful than doing them by themselves. So things like you can find videos on YouTube. A very simple sort of mindfulness exercise. I haven't included it here, but is to use the rule of 5. So kind of stop yourself when you can feel yourself getting overwhelmed, and just bring yourself to the present and think of 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. So using those 5 senses, that's sometimes a bit easier, but it's definitely a skill to be practiced. Thank you. That's a really valid point, really good contribution.
I'm just going to say, I don't know if you can hear me, that I've been doing this for many years, and all I can say is practice, practice, practice. I trained as a midwife, and I was teaching mothers how to relax. Then I ended up doing it during my own pregnancies and so on, and it just became a habit. And I found just doing that on a regular basis for no particular reason except unwinding after work. And then when one is faced with various problems that, you know, come along in life, it's very easy to just switch that switch on. So it does need practice.
Yeah, absolutely. Absolutely, Mary. It's a bit like I remember one time I was feeling quite poorly. I think I must have had a cold or the flu years back. And I went to the pharmacy and said, I'm feeling unwell, I need some vitamins. And she said, well, you know, vitamins are something you should take not just when you're ill. It is a preventative measure, but it, you know, we don't think about it until we need it, when we're in a crisis or when we're feeling unwell. So Mary, that's a really good point, and thanks for bringing it and reinforcing this message that it is really about practice. Any other comments before I move on?
Yeah, I've got a quick one. I've got drug-resistant epilepsy due to TS, and I'm also an artist. And I know I'm going to compare it to drawing, that if I don't draw every day, which I do, my hand gets out. And so I set time aside for me to do that. And the more you do it, you kind of have this yearning to do it. And I think the mindfulness is a similar thing. I completely relate to what the First Lady was saying. It's very difficult. I used to work in the corporate world, and now I'm studying an MA about mindfulness and animation. But I bring it back to my drawing and my sketching. The more you do it, the more you want to do it. And in fact, drawing is a bit like meditation in itself anyway. And Mary that was talking about it, who's been doing it for years, it's you just kind of have to keep doing it and accept if your mind does the whole monkey jumping thing, that's okay. Even just have like a couple of minutes of this Zen feeling, and your cheeks kind of go a bit warm, and you think, oh, that's so nice. It makes such a difference. So yeah, talking from a TS patient point of view, it really helps. And the whole acceptance thing as well. Thank you, by the way, Dr. Black. This is great.
Thanks, Sarah. It's really helpful to hear from, like, you know, someone who has been practicing and has experienced that kind of, you know, once you get into it and it starts to, you notice the benefits once you start to use it regularly. And yes, yeah. So it's maybe about making time for it. Yeah. Thank you very much. Okay, so continuing with the mindfulness, I'm just going to talk about the position we take when we are being mindful. So we move from the thinking self to the observing self, and this is a part of the mind that is doing the noticing and the being aware of our experiences. Okay, it's a viewpoint from which to observe those thoughts and feelings that we're having without getting caught up in them. Okay, and this is where cognitive fusion comes in. Okay, so cognitive fusion it happens when we become fused with our thoughts. Okay, and we might get caught up in them or be pushed around by them. We might see them as a true reflection of the reality, and they might dominate our behavior. Okay, so it's kind of getting really wrapped up in those thoughts to the extent that we believe they are true and that they determine what we do or don't do. One way out of this is by separating or detaching from those thoughts. And by stepping back and creating the distance, we're less fused with those thoughts, and they're less likely to have so much control over us and over our behavior. And it's been likened to letting thoughts come and go, like passing cars on the motorway, for example, or if you were sat on the side of a bank watching the water flow by and watching the leaves flow by, imagining that the cars or the leaves are like each thought that comes into your mind. Okay, so not allowing them to stop and get really caught up in them, but noticing them and allowing them to pass by. Okay. So we've spoken about these kind of 3 key parts of ACT. We've talked about acceptance, mindfulness, and cognitive fusion and diffusion. So the next part that I mentioned at the beginning was about taking action and doing those things that are in line with your values. So we might start with a goal, something in the future that we want to achieve, and we situate the goal in context with our values that are underlying that goal. And then we might think about the discomfort that we will be willing to accept in order to achieve that goal. Okay. So as an example, my goal might be to go out to a party to meet new friends. Okay. The values underlying my goal are, I really value close friendships, and social connection is really important to me. The discomfort that I might have to experience in order to go into that situation might be around my anxiety in social situations. I might have thoughts that people might judge me, people might not like me, I might not know what to say, people might get bored of my conversation. And if I'm fused with those thoughts, I probably am not going to go to that party, and I'm probably not going to make new friends. And that's not in line with my values of what's important, which is for social connection and making new friends. So there's an element of discomfort there that I might have to get through in order to do things that are important to me. Okay. So when embarking on that journey, on that action plan, we might hope that our plan is like that first image at the top. Okay. In reality, there are likely to be ups and downs along the way, hurdles that we face, times when it's easier to not do that thing, that goal that we're working towards. Okay. And this is all because there are 2 sides to the coin. Okay. So when something's important to us, there's always the fear of not being able to have it or to experience it. And if we didn't really care about something, we wouldn't care if we didn't get it. Sometimes I use the example of stamp collecting. Okay, if someone told you that throughout the rest of your life you're never ever allowed to do stamp collecting again, would you feel upset? Would you feel bothered about it? There may be some stamp collectors in this meeting, but for a lot of people, it's not something we really do anymore, and it's not high on our agenda. Okay. But if it's something that's important to us, there is something about it having value, but also fear attached to it. Okay. So it's important to notice those feelings of fear, but not allow them to dictate what you decide to do and how you live your life. So I've talked a lot about ACT, but why ACT in TSC? What's the relevance? What's the importance? So the TSA 5-year strategy for research is to reach more people and drive more research. And there are a few areas that are really important for children and young people with TSC. We know that many people have psychological and social needs as a result of living with TSC. And some of the priorities for research into TSC are around looking at the unmet needs, looking at TSC associated neuropsychiatric disorders, and improving treatments, improving the mental health of people who are affected by TSC, and thinking about how we can best deliver services that support people living with TSC. There's lots of research into ACT as well for people living with long-term health conditions. And also, it's been found to be an effective intervention for children and young people. At present, there's no research into ACT for children and young people with TSC. So this is completely new. And it's a project that my colleagues and I are running as a research trial in Bristol. I just want to acknowledge that the funding for this project was received from the TSA, and an incredibly generous anonymous donor. And I want to acknowledge their incredible generosity, which has made this research project possible. So I'm going to share now with you a bit of information about the trial and let you know where we're at with it at the moment. So because we acknowledge and we realise that there are unmet psychological and social needs of people and young people living with TSC, we want to find out if ACT, the talking therapy, helps. Our aims and research questions are to find out whether it's feasible to deliver individual ACT therapy with this age group, population, and in the context. I'll talk about the context in a moment. Whether ACT is an acceptable intervention to participants, their families and therapists, whether it's an effective treatment for reducing distress and improving the quality of life among children and young people with TSC. See if it's feasible to measure the benefits of the ACT intervention using the measures that we've chosen to use to measure our outcomes. So the intervention will be offered to patients nationally across the UK, and it will be available for 11 to 24-year-olds who have been diagnosed with TSC. We're hoping to recruit 50 participants, and we'll be recruiting participants through specialist TSC clinics, and as well as publicly via social media and via the TSA. If you would like to find out more about the study and how to take part, there will be more information on the TSA website, or at the end of my presentation, my details are there so you can contact me directly. Participants will be randomised to receive treatment either immediately or after a 12-week wait, and the treatment will involve up to 12 weekly sessions of ACT, which will be around 1 hour each in length. The therapy will be offered via video calls, so like this, like on Zoom, so that people won't have to travel to the hospital. And this is really important because the geographical availability of TSC services can sometimes limit access to appropriate and necessary services. So hopefully with COVID, people have got used to doing things online, and we'll see. We hope that it will be useful and mean that people don't have to travel long distances to get treatment. The outcome measures will look at anxiety and depression as measures of mental health, quality of life, and then some ACT specific measures. At the end, we'll do some qualitative interviews to find out how the participants experienced the intervention and what they found helpful, what they would like to have done differently. We've just had our ethical approval, so we're going to start recruitment really soon. And we're hoping to complete the trial by the end of next year. Now, because we are using ACT for children and young people, there are some slight adaptations of the model. It's got all the overarching principles of ACT that I've already described. So acceptance and commitment, taking action, and breaking away from those thoughts that we might get fused with. So the difference really is adults have often developed their values, developed a good sense of what's important to them and their life goals. Whereas with children and young people, we recognise that they are still very much in development. So we use these 3 skills to help that young person to think about their strengths and to think about the things that are important to them in their life. Okay, so I'll go through each of them. We use the discoverer as something to describe the part of you that does things in the world. Okay, it explores, it tests things out, and it uses trial and error to find the best path forward. Okay, so it's sort of about kind of what we do, what we're doing in the world. We use the noticer, which is another part of us, to be able to see and to feel what's going on inside us as well as outside of us. And that's part of where the mindfulness comes in as well. So showing an awareness and noticing these things going on around us and inside us. So we use our body and our senses. The advisor is our inner self-talk, which uses past experiences to help us navigate in our day-to-day lives. It tells us what's good, what's bad, helps us make decisions, helps us to fix problems. It's that kind of inner dialogue that we experience on a day-to-day. So what we would work towards in the intervention with young people is the 3 A's: aware, accept, and act. So the hope is that by helping a young person become aware of the senses in the world and around them by using their noticer, they might be able to develop an ability to accept thoughts and feelings and sensations as a normal part of the human experience, to use their advisor in a flexible way, choosing when to listen to the advice it's giving and when not to. So your advisor, if you're feeling anxious, it might tell you, don't go to that party. You know, you might make a fool of yourself. People might not be interested in anything you have to say. You won't make any friends. We can choose whether or not to listen to that advice and that inner dialogue, so that we can continue to live life in ways that are in line with our values and what's important. And then the third one is thinking about how they can take action and engage in those things that bring value and vitality into their life using the discoverer. And that might be about trying something new and tolerating that discomfort that comes with trying something new when there's something that's important to you that you want. Okay. So I'm going to finish up with a summary. I've talked quite a bit, and then there'll be space for us to think and talk together. So ACT is a type of talking therapy. It aims to change our relationship with our difficult thoughts and feelings, so we learn to perceive them as harmless, even if really uncomfortable, transient psychological events. It means allowing our thoughts and feelings to be as they are, regardless of whether they're pleasant or unpleasant. We can use mindfulness and the observing self that helps us to notice and to stand back from those internal experiences. And we've talked about values, which are those statements about how we want to live. It reminds us of what really matters and helps to steer us in the right direction that we'd like our life to go in. And then I talked a little bit about the research in this area for children and young people with TSC, and there's very little research on psychological interventions for children and young people with TSC, and no research on the use of ACT in this population.